Daviess County is a county located on the northwest side of Illinois, and it borders Iowa and Wisconsin. It is about 619 miles long, and it has a population of about 20,000 people, with the median age being 49 years old. The leading cause of death in Daviess County is cardiovascular disease. There is only one hospital in the county, and all the EMS and firefighter workers are based off a volunteer basis. That being said, it is harder for the residents to gain access to health care because they live in such a rural area. Cardiovascular disease, also known as heart disease, is a condition when plaque builds up in the walls of the arteries. When a blood clot forms, it stops flow and it causes a heart attack. According to the American Heart Association, most people can survive their first heart attack, but they need to make lifestyle changes after that. There are 4 illnesses that fall under the cardiovascular disease umbrella. They are heart valve problems, arrhythmia, heart attack, and stroke. Most of these conditions can be treated through medication, but some other ways that they can be treated is through heart valve surgery, an angioplasty, or a pacemaker. Some symptoms of cardiovascular disease include chest pain, shortness of breath, dizziness, and pain in the neck, jaw, throat, upper abs, or back. Men are more likely to have chest pain, whereas women are more likely to suffer from shortness of breath. Some risk factors for cardiovascular disease include age, sex, family history, high blood pressure, excessive use of alcohol or caffeine, smoking, and physical inactivity. Here we have some examples of some products that people can consume which can put them at risk for cardiovascular disease. Some complications that can occur from cardiovascular disease include heart failure, heart attack, stroke, an aneurysm, peripheral artery disease, and sudden cardiac arrest. Some tests that can lead to a diagnosis include an electrocardiogram, cardiac catheterization, a CT scan, an MRI, and an echocardiogram. Some treatments for cardiovascular disease include lifestyle changes, a low sodium and low fat diet, and at least 30 minutes of exercise per day. Medications for cardiovascular disease vary based off of the heart disease that you're suffering from. You can also get medical procedures or surgery. Heart disease accounts for nearly 801,000 deaths in the United States. And according to the American Heart Association, in 2014, deaths were represented at 31%. Heart disease is the leading cause of death in Illinois. It has a mortality rate of about 32,000. Males, African Americans, and people living in southern and eastern counties are at higher risk. Morbidity causes disability, years of life lost, and healthcare costs. Prevalence of heart disease in Illinois is more than 320,000. Some benefits of regular exercise to maintain a healthy heart include an increase in exercise tolerance, reduction in body weight, reduction in blood pressure, reduction in bad cholesterol, increased good cholesterol, and an increase in insulin sensitivity. You should be exercising at least 30 minutes per day. Some diet tips to maintain a healthy heart include a variety of fruits and veggies, whole grains, low-fat dairy products, skinless poultry and fish, nuts, and non-tropical vegetable oils. Here at the Joe Daviess Rural Health Incentive Program, we have 2 main goals. Our first goal is to educate residents, and our second goal is to create incentive programs for a healthy heart. Our program includes cooperation from the 23 different fitness centers in the county to provide lower rates for all of our residents. We are offering seminars to educate residents on healthy eating, exercise, and lifestyle choices. Some of our incentives include a media recognition in a Heart Healthy magazine, along with monthly raffles for prizes such as gym memberships, and most importantly, a positive change to a happy, healthy life. Our goal is to lower the amount of residents living in our county suffering from cardiovascular disease. We hope in the near future that we can get the mortality and the morbidity rates down, not only just in our county, but in the state of Illinois as well. Thank you for listening, and thank you for supporting the Joe Daviess Rural Health Program Incentive. If you have any more questions about cardiovascular disease in Joe Daviess County, you can go to their public health website, and you can also like them on Facebook.